Morning to all and all. Welcome to CU session for today. Today I'm going to be critically appraising an online article. So before going into uh, the appraisal itself, I would like to give you a imaginary scenario. So a 16-year-old obese male who is a known diabetic is admitted with unstable angina under medicine and also found to have elevated creatinine on evaluation. So he is initiated on standard treatment for his current illness as per guidelines. During a family meeting, the son just asked about a drug called semaglutide and refers to a recent news article which is read to prevent further cardiovascular and kidney disease events. So, is this internet article valid enough to make an informed decision? So, we will be critically appraising this article which talks about the study itself. So, before going into the article itself, I will just give a overview as to why we should appraise an online article. So, online articles could be written by multiple people, depends. We don't know, we always do not fact check as to whether the people who have written it, what they have written, do we go back to the references and check, is not ideally done always. So, but there are some pitfalls, there are some advantages and disadvantages. So going into each, like the presentation itself of the article itself could affect your reception and understanding. If there was good content but it was not appropriately presented, you will not understand it. If there is language issues, there are grammatical issues, you might interpret it a little differently. Good information can be poorly presented. That is one thing which we should know. So high quality information may not always be relevant. Is it relevant to what you are searching it for? So we are just looking at news articles or research articles which are published in a medical journal or a medical news site itself. So you're not going into the article per se. So readers should critically evaluate biases. Is there any bias which could be easily picked up from the article itself? And hidden biases or errors can be misleading. Published results may not be always error-free. We will always go back to the published article. But if we have this article, how do we appraise it? So if we appraise it properly, we might find some biases present. And credibility of the person who is writing it, the author for the article itself, and academic work, which is usually high value due to its prestigious source. We always feel better when we read an NAGM article. We think always they have accepted an article which is properly standardly done. So there are some pitfalls which we should address to, and that is why we need to be able to appraise an online article also. So this is the article which the Sun has showed us. So he is showing an article which says drugs like Ozempic could protect kidney health in people with heart disease and obesity. So this was the article which is published in Medical News today. It is a US journal for medical news. It's written by Gauri Palk and fact checker Amanda Watt. We'll come to that a little later. So what is prompt checklist? Prompt checklist is an advanced evaluation of any research material which you find on online platforms. So what are the abbreviation it stands for? It stands for provenance, relevance, objectivity, methodology, presentation and timeliness of the article itself. So we will be going one by one into each subgroup, and then we also have certain hints as to what we are supposed to look for in each of the settings. So first we are going to presentation. So things to be aware of under presentation is the choice of color, font, diagrams, is there a structure to it, layout, is there any poor use of language, grammatical errors, is there an ineffectual writing style itself, or poor reproduction of facts. So those are some things which we need to fact check before we actually go and say that the article is good enough to be shared or believed upon. So I've just put in two screenshots from the article itself, not copied it, just to show that how it's written, what is the font looking like. They have chosen black as the font color, which is good, which is usually agreed upon. And the article font is also not in a way where it's cursive, where you don't understand few words. This is a standard font from Microsoft Word which they've used. They've also highlighted certain fonts which they feel is the brings up the actual core of the article itself. They've also highlighted in blue with a hyperlink as to wherever the patient might not be a medical personnel or someone who is not medical personnel still could understand these things by going into these links and finding out what it actually stands for. So they've adequately done that part. The presentation part looks okay. But I found a little off with the reproduction part. So they have mentioned in that article that all these results are from Select, and they've given a link for that Select article. When I went to that Select article, it goes to a different article actually. So I tried multiple ways to find it, but still it went to the different article which is not even related to the news article which was actually presented. So while the actual article is this which was presented in Nature Medicine, it was actually a different journal and a different article itself. So which I found which was misleading, and people who go in and find a different article might be like, okay, this article or the information provided in this news article is not relevant enough, it's not appropriate, they have wrongly or they are misinforming people, and people might actually follow this. So this was one major drawback I found in this article itself. So going to presentation, font color, font size is fine. Graphics, they had no graphics. They could have given an easily understandable graphics which a layman could understand, or a medical person could understand in such a way that they could have given a survival analysis with appropriate markings as to what does it mean. So people could have understood it, but that is not there. The structural layout was fine, language is good, the writing style is good, reproduction of facts was a major flaw in this news article. So the next thing is relevance. So relevance, how do we check relevance? So what are you searching it for? So you're searching something on the internet and this article pops up. Does it fit into your clinical scenario? So my patient, so I'm just checking whether it's relevant to my patient now. So the population, so they have, this is a study which was done in populations of people who are obese, cardiovascular disease. And what is the disease they're looking for? Chronic disease or progression of chronic kidney disease, comorbidities, diabetes, and outcomes they look for is kidney outcomes, which is appropriately relevant to my search scope. Will not be usually always relevant to whatever you search for. So you always should check, is it relevant to my search scope before you go through the results itself. So geographically, they have not mentioned where it was done. This is a US medical news article, but where it was done, which population was more. So that is not informed in this article, which is a major drawback I face. So the relevance regarding the geographic location might not be appropriate because it's not mentioned. You might have to go into the article itself to know more. So this is regarding relevance to the article to your setting itself, which I felt was relevant to the population a lot, but the geographic location I couldn't find much evidence. So the next point is going to be objectivity. So how objective was the article? So what are the things we need to look for? Perspective of the author itself, opinions, language, and is there any sponsorship? These are the things which we can go to look for and appraise an article if there is anything which is objective in the article itself. So going to perspectives, they have mentioned in broad bold letters as headings as to what their actual perspectives are, the major perspectives. So semaglutide use lowers the risk of adverse kidney related events, improves EGFR and UACR, which is urine albumin creatinine ratio measurements with separate reduce. They have also at the end said that more methods of protecting kidney function are needed. So they have not gone into clarity, but this is the major viewpoint they have mentioned in the article itself. Which seems fine because they have not gone out of the way and expressing anything which is extraordinary about the article. Evidence. So they have mentioned in the article itself that the research evidence was not published or peer reviewed yet at the time of publishing of the new article, which is not right because the article which was sent to probably a journal, say Nature Medicine, they have sent. They have not reviewed it, they have not published it, we don't know whether it was accepted or not, but they have already published a news article saying that it is working. So which was not right is what we felt. But going back and checking it, this news article was published on 25th and Nature Medicine has published it on 25th also. So they have mentioned that it was not published yet. So it is not right. They could have waited a few more days, looked at the article, peer reviewed it, and then maybe gone with the evidence and published it saying that this is working. The sponsorship was done by Novo Nordisk. I'll get to it in detail when we come to provenance. So there was a sponsor which is Novo Nordisk, which was involved in the trial itself, which is also a flaw. We'll come to that. So the material. So is there anything about the research methods of the trial itself? Is it a randomized trial? Is it controlled trial? Was there blinding? All those things which are really important to understand whether the RCT was properly done or not was not mentioned in the article itself. They just mentioned that total participants of 17,000 just to make sure that it seems like a big study was done, but no mention of the trial details, how it was done, what is the problem, they mentioned the outcomes, they mentioned the number of participants. Nothing else was mentioned, which is really not right as per appraising this news article. So I'm not going to the rest of the things because none of the methods have been actually given. So going to provenance. Provenance is to go into detail as to are there enough credibility in what they are actually saying. So what are the things we look for? So they are looking at who's the individual who's publishing it. So I've gone into and found out who's actually publishing it. The name is Kohli, who's a medical news today journalist. So what is she? She is a journalist who reports on research articles alone, nothing else. So she is someone who's been doing this for 2 years. So while Amanda Ward is someone who is a pediatric pharmacist who's involved in pharmaceutical research programs and who has actually fact checked this. And this is what these are the two information they're given according as to what is new, who has written this news article and was peer reviewed or fact checked it. Are they good enough to have written this article? Oracle is someone who's writing a research journal in a news article about research articles. So she might be a little oriented towards writing about the articles itself. But is Amanda Ward a good enough person to actually peer review it? I was not sure. She's a pharmacist. She's been involved, but is she a peer reviewer? Not. I didn't find evidence to actually find she's not a peer reviewer actually. So that's the first question. So then the next question is about the editorial board. The editorial board, nothing was mentioned about who is the editorial board. They have a board which it goes, the articles go through and they approve it. Nothing as to how they fact check it, how they contact peer reviews and find out is it actually valid to publish this was not actually done. This is the journal well regarded. So we're going to now we're done with the article itself. We're going to the journal. So the journal well regarded and does it have a high rating in journal citation reports? Is the information in the journal peer reviewed? So for that I've gone into the ranking and metrics of the journal itself, which is Nature Medicine. So Nature Medicine has a very high ranking in journal article, which is research ranking of 4 and impact score is 69. So impact score for the medical journal this is a very high, highly rated article. Like some other journals which can have higher impact scores are NEJM, BMJ, and this might be the third or fourth in that case. So this is a good journal. So they should have peer reviewed it before publishing. So who had peer reviewed? They have given names as in the article. So when I went back to the article to find that it has been peer reviewed by three, four people, like anonymous people. They adequately checked facts before they actually published it. So the journal has published adequate, a proper trial, but the news article did not mention about it. So more about it, to go into acknowledge experts, the writers were not experts. So the people who have given some interviews in this are the experts. So I've went into the article itself, I've taken a screenshot of it. Someone called Professor Bennett, who's been doing research in semaglutide for a long time. In all select types, she is involved. So she is an expert in that subject area. But the way she has put it up in that article is very vague, saying that by addressing key markers of kidney health, may contribute, again a vague term, to a significant reduction in risk of kidney-related complications. We'll come to that as to numbers later on. As it used controversial, nothing controversial here, frequently cited. So the next thing is citation. Is it being cited everywhere? Is people all over the world using this article to cite their own work and say that, okay, this is working. In that way, I'll come to this. So this is the citation which is mentioned in Nature Medicine for the article itself. So this is a relatively new article which is published on 25th May. Not much citations, cross-reference is the citation which is not there. Why an online application? It has been widely publicized everywhere. Again, there is why you should actually critically appraise an online article before even agreeing to what they say. So you can find that 183 tweets, 1 Facebook page, 6 news outlets, and 2 blogs have been already publicizing this article, while there are not of citations yet. So going into this, so I thought maybe it would, maybe people who are peer reviewed or people who are neutral, they gave an opinion about the article and say that semaglutide is a good drug, that would be a good option. So they have also interviewed 2 people, someone named Ali MD, who is a pediatric surgeon, whose expertise is surgical management of weight loss. He is expert in that. And someone named Chen Shin, who is a cardiologist, who is an interventional cardiologist. Both of whom I do not think are appropriate enough to give opinion about this, because they have not read the article. They have given vague terms as in that the kidney function is protected and improved, and they are like it is not surprising to. So they are not talking facts, but generally saying that this works. They have not. It seems like they have not read the article at all. This is where they are directly saying it's working, but we already knew it would work. So this is not right, is what I felt. And a cardiologist has again said that has a capability of slowing progression of disease as per this trial. So that is not how I feel that an interview should be done. They should have been asked to comment upon and critically say that this drug would have helped or not. So going beyond that, they have not asked any other neutral person. They have asked the person who done the study, 2 other persons who are not related to the study but not their expertise. They could have asked an endocrinologist, they could have asked a nephrologist or an internal medicine physician who would have been appropriate enough to comment upon this. So other than that, going into the sponsoring organization, this is from the article itself. So this trial was entirely done by Novo Nordisk, right from trial design till analysis, which you can pick it up only if you go back to the article itself. This is from the article where they mention conflicts of interest. I just highlighted Novo Nordisk on the conflicts of interest. Almost every author is associated with Novo Nordisk in some way. They were either employed by them or they got grants from them. So they have mentioned in the article itself that the health protocol was designed by them. So I am not very sure as to how much this article was influenced by them. Could have not been influenced also, which we cannot confirm the data. So timeliness. So coming back to the news article and the article as a whole, is it clear when the information was produced? Yes, it's published in on May 25. Does the date of information meet your requirement? Yes, it's very recent, and you can apply it if the facts are right. And is it obsolete? No, there are no more new research after that which contradicts or confirms with this. So I also want to give another score, which is vaguely mentioned in multiple papers as to when you are appraising a internet article, which is given by JAMA itself. There are 4 domains that are giving in that, which is authorship, the authors and contributors, their affiliations and credentials provided, which is not provided in the news article. Attribution, are they referenced and sourced for all content, which is clearly mentioned, and copyright information noted, which is not given. Again, the information which they reproduce also is wrong. They've linked the wrong article to the news article. Disclosure, they have not mentioned about any ownership or who is involved in writing it up, is there any sponsorship to the article itself, which is not mentioned clearly. Currency, the only thing which was really well done was rates were mentioned, updated. They have updated the article after that activity, which is also mentioned correctly. So out of this, it's 1 out of 4. 1 being the lowest, it's not good at all. They are not given any range as to what is good and what is not. So general understanding, I'm saying it's like 1 is the low score and 4 is the best score. 1 is a very low score, to say that this article is good enough to be used for a information. So coming back to mutation, now like I know that I can say I'm saying that the article is not good enough to be believed upon and to make a decision by itself. So would I do anything further? I can, being a screening physician, I would want to go and look at the evidence itself. I just in 2 slides tell about the article. This is the article which they have mentioned in the news article, Nature Medicine, long-term kidney outcomes of semaglutide and obesity and cardiovascular disease in the SELECT trial. So going into that, I'm not going into detail, I'll come to the validity side, but I found one thing in baseline characteristics, that in kidney characteristics specifically, which is the specific outcome they look for, there is all difference of 0.4. It is fairly matched, but there is a difference of 0.4 across everything. Here we have 1, we have 0.4 here, we have a 0.4 here, and we have 1 difference here. So there are minimal differences, but overall it looks fairly matched. So validity of the study, the SELECT trial, randomization was done, blinding was done, all 4 were blinded as a participant, the character investigator and the outcome assessor were blinded. Allocation concealment is also done. Baseline characteristics is fairly matched overall, but 0.4 to 1% difference, which we know only when we see the outcome whether it's actually relevant or not. Analysis was intention to treat analysis, and power calculation was not calculated for the kidney outcomes at all. It was actually a study done for cardiovascular outcomes, and they just extrapolated and published a trial saying that this could be useful without calculating power for this outcome. So going to the results of the study, so this is the overall outcome that we looked in the study, which is 5 component kidney composite endpoint, which is death due to kidney disease, initiation of CKD replacement therapy, persistent EGFR less than 50, persistent more than 50% reduction in EGFR, and persistent macroalbuminuria. Of which, if we look at the overall endpoint, which is the composite endpoint, there is a difference of 0.4. Coming back to the baseline characteristics, we already found that there is a 0.4 difference even in the kidney characteristics already. And here you can see it is favoring the semaglutide arm, but the confidence level is reaching up to 0.96, which is very close to the null point. While other individual endpoints are not significant, everything is crossing 1, even macroalbuminuria is at 1. So overall there is a composite endpoint difference, which is 0.96, so 0.63 to 0.96 of confidence interval with the hazard ratio of 0.78. Going to individual again, so they have also mentioned in the article that the only difference where they actually found was in people who had EGFR more than 60, where it is significant with the confidence interval lying on the side, which is favoring semaglutide itself. While we also saw in the baseline country the actual difference is 0.4 difference. So coming back again, I've gone behind the news article and checked the actual article also. Will I be giving the patient the semaglutide drug to prevent renal outcomes? So the only renal outcome which it actually prevents, if you look at, is the macroalbuminuria. So the difference here, you can see the 0.04 is 2 in the placebo arm and 1.6 in the semaglutide arm, which is actually translated into 2.1 and 1.8, which is 0.4 difference. So will that be good enough to say that there is no progression of kidney outcome? I would not think so, and I would not suggest the patient to be started on this drug. I could go further and explain the cost, because it is costly, and amount of effect we get in the short term is not great. In long term, we need more studies to know.